draft is better than your last draft. Rapping like a vampire, wrapped in a black sash, all blood.
The study to be introduced today is an analysis of the nutritional and survival advantages of function-preserving gastrectomy in elderly patients with early gastric cancer, as the diagnostic accuracy of gastroscopy improves. The incidence of early gastric cancer continues to increase. Early gastric cancer can be treated with function-preserving gastrectomy, and proximal early gastric cancer can be operated with subtotal gastrectomy or proximal gastrectomy. As the prevalence of early gastric cancer increases, the number of elderly patients with early gastric cancer is also increasing. However, surgeons are still hesitant to perform laparoscopic function-preserving gastrectomy on elderly patients. The reason is that the safety of LFPG is not certain, and the advantage of LFPG is also not clear. Therefore, in this study, we investigated the advantages of function-preserving surgery, specifically laparoscopic proximal gastrectomy and laparoscopic subtotal gastrectomy, in early gastric cancer. Safety, nutritional outcome, and oncologic outcome were evaluated. This is the flowchart of this study. Patients aged 75 years or older who underwent surgery for early gastric cancer between 2005 and 2019 were included. Cases that underwent additional gastrectomy after ESD were also included. Patients were classified according to the method of surgery, and cases with similar surgical indications were compared. Therefore, the LPG and LTGP groups were compared, and the LSTG and LTGS groups were compared. Result: shall we take a closer look? There were 30 patients in the LTGP group and 48 patients in the LPG group. There were 32 patients in the LTGS group and 24 patients in the LSTG group. There were no significant differences in basic characteristics, including pathologic TNM stage. This is a table about the surgical results of each procedure. The operation time was significantly longer in the proximal gastrectomy group than in the total gastrectomy group. It shows that the amount of bleeding in the subtotal gastrectomy group was significantly lower than that in the total gastrectomy group. Finally, there was no significant difference between the two groups in the incidence of total surgical complications. This indicates the stability of function-preserving gastrectomy. The nutritional parameters were compared as follows. This is a line graph compared to total protein. The proximal gastrectomy group showed significantly higher total protein levels than the total gastrectomy group at 6 months, 12 months, and 24 months after surgery. The subtotal gastrectomy group also showed significantly higher total protein levels at 24 months after surgery. The following is a graph of the comparison of albumin. As before, LPG showed significantly higher albumin levels than the LTGP group at 6 months, 12 months, and 24 months after surgery. The LSTG group also showed significantly higher albumin levels 6 months after surgery. Below is a graph comparing hemoglobin. As before, LPG showed significantly higher hemoglobin levels compared to the LTGP group at 6 months, 12 months, and 24 months after surgery. The LSTG group also showed significantly higher hemoglobin levels 6 months after surgery. Next, we looked at changes in body weight and skeletal muscle index. Compared to before surgery, the proximal gastrectomy group showed less weight loss after surgery than total. The STG group also showed significantly less weight loss at 6 months after surgery. Compared to the preoperative period, both the proximal gastrectomy group and the STG group showed significantly less reduction in skeletal muscle index after surgery compared to the total. It shows that function-preserving gastrectomy is superior to total gastrectomy in terms of nutrition. The following is the Kaplan-Meier curve for overall survival rate. Although the stages of the two groups in the table above were similar, the overall survival rate was significantly improved in the function-preserving gastrectomy group. There are several limitations in this study. First, it is a single-center, retrospective study. The second is that the patient's subjective symptoms or condition were not assessed. Third, the indication for each operation was different. Each indication was compared by matching, but it is still a limitation. The fourth point is that there may be differences in skill between each surgeons. Conclusion: function-preserving gastrectomy may have advantages in treating elderly patients with proximal early gastric cancer. In particular, it can help maintain nutritional status and improve survival.